Okay, so I'm going to begin. For those of you that don't know, my name's Rubina. I'm an academic recruiter. I work for ADMI, which is Aspen Dental Management, and we're the support organization for Aspen Dental, Aspen Dental nationwide. So, as you know, Aspen Dental is a dental support organization. We have over 800 offices nationwide, and we're here to support the dentists and support our doctors to do what they need to do, which is focus on patient care. So we help out with like the marketing side, HR, business development, growing their practices, all of that fun stuff. So again, dentists like Dr. Jimmy Schooley can focus on patient care. So before we begin and before we do an introduction, there's a question and answer box on the bottom. So if you have any questions while we're going through this Ask Me Anything session, feel free to type in your question. I'll be the moderator and I'll go ahead and ask those questions to Dr. Schooley. Often you will see me looking to the side, and that's because I'm going to put the questions there and be able to answer them there. So there's like a pop-up open box and everything. So it's not me looking at anything else. It's just trying to organize everything and be a moderator.
At least that's what he says.
What's that?
No, I nothing.
Oh, so if you do have any questions, there's also an option to ask them privately. So feel free to do so. And then you can also email me, because I'm sure a lot of you guys have my email since you did sign up and register for this. But other than that, we're going to have Dr. Jimmy Schooley introduce himself, and we will begin the Ask Me Anything session.
So, hi guys, I'm Jimmy, or Dr. Jimmy Schooley. I went to OSU for undergrad, went to OSU for dental school. Actually, I was in medical school at OSU before I switched to dental school. I get a lot more, so anyone that was debating that kind of one or the other, I think you made the right choice with dentistry. Right when I graduated this past year in 2019, or not this past year, but in 2019 I graduated, worked for another DSO in Virginia for about 6 months. I was going down there kind of for personal reasons, visit family. My girlfriend was finishing a residency down there, so went down there. Always kind of had plans to come back and work for Aspen, because my brother actually is another Aspen Dental doc. So I've been back here since January, right before everything with COVID. So that was interesting for a little bit, but we've been up and running, and I'm here in Columbus working in Hilliard right now.
That's awesome. So what options did you have coming out of dental school? I know you wanted to be at Aspen, but what were all your options, and I know you said personal reason for the other DSO, but I guess why Aspen?
So basically, I'd say all options were open to me. My dad actually is a general practice, private practice dentist here in Columbus. He works with my uncle, so he's not planning on retiring anytime soon. But even with other associateships, I was looking at those. I looked at basically all the different DSOs. I was a big lunch and learn guy, so anytime there was free food, I really just went and sat in the back. And most of the time I was there for the food. Sometimes I'd pay attention, but when it came time to really figure out what I wanted to do, I'd take notes, like the pros and cons of each of them. And Aspen really always stood out. They had a lot of benefits, a lot of the things I was looking for. Part of the reason I went to another DSO when I was in Virginia was because there was not an Aspen office within the kind of vicinity where I wanted to be, which was it's surprising, just because Aspen actually is like the largest de novo DSO in the nation. So they're pretty much anywhere you'd want to be. But yeah, so I was looking at everything, and kind of when it came down to it, it had the most pros. And on top of that, I had met the owner of my office and a bunch of the other Ohio offices, because he's my brother's owner, and I just really hit it off with him. And I think that's a big thing, is kind of seeing who you're working for, no matter whether it's DSO, private practice, associateship, anything like that, like who the owner of the office is, because that can really make a difference. Whether it's, even some Aspen owners are better than others, so it just kind of depends. If you really get a good relationship with and get to know the person you're working for, I think it can make a big difference.
That's awesome. So basically, it was me and Jeff Gehring that convinced you from our lunch and learns.
And that's the thing. I knew Ruby was going to say, like, we had some fun at tailgates. We had some good times. Probably nothing I can really say on any Zoom webinars.
Vibe session. That was fun.
Good time. We had another one of those. where was it? Chicago or something like that?
Dallas.
Dallas. There was one
Yeah.
in Dallas. That was a good time as well. So, and that's the thing also, like, and that was part of the thing I realized when I switched from med to dentistry. Not only did it fit more of my personality in terms of like interacting with patients and things like that, but dentists and Aspen dentists in general really they know how to get the job done, like do good work for the patients and things, but they also have a good time too. And that was really something that I really enjoy, like, cause you know, you're looking at teeth and doing things all day. You kind of want to relax and let loose in the evening. So that was another
Definitely.
plus.
Yeah. Yeah. We have a lot of great events. We have vibe sessions, which, this year we're doing it virtually, but, usually it's like 200 students nationwide. We fly them out, have them speed date interview, get to know our culture, meet speakers, and, go out and have a really good time. And, I mean, we had already met prior to that, but
Oh,
yeah, it's just like a really good time to have dentists see, or soon to be dentists, see what we're like culture wise, because that, like you said, it makes a huge difference. You do your dentistry, and then afterwards you want to have some fun when the opportunity comes.
definitely.
That's awesome. So someone just asked, what advice would you give a dental student to be prepared coming out of dental school?
Honestly, looking back, if I had to do anything different, sometimes they'll give you like opportunities in third and fourth year to like do different electives or try different procedures. And I, I was like, I got good grades. I did my work, but I was not like the most diligent about being in clinic more than I had to. Like I showed up when I had a patient, and I basically had any excuse in the book to not be there if I didn't have to be there. But there were times in retrospect where I was like, oh, I could have looked at a few more implant procedures or done some like tissue grafting or things like that in those different electives. And I mean, in the end, it doesn't make a big difference, because I tell people you'll learn more in your first week, month out. I mean, I know more after 1 year of doing dentistry than I learned in all of dental school. Like
Wow.
you're sitting there and you're seeing things for the first time, and you're actually like having to look at x-rays and do treatment planning without having a faculty member look over you, and you ask questions, whether it's family, friends. My dad, I'd call him probably, I think my first day I called him like at least 3 or 4 times just to be like, hey, am I reading this right, just to make sure, because
Yeah.
I've used YouTube a few times too. So but you learn so much. So I tell people, don't be like, you're going to feel like you know stuff when you graduate, but also you're going to learn a lot too. And don't be afraid to like, not experiment, but also like, you're going to get better. So don't think that you need to know everything right when you graduate, because that's what having mentors is all about. And that's a nice thing about Aspen. You have doctors, whether it's in your office or nearby offices, to help you. You have owners that can help you. You have support people like Ruby to help you. So that's the nice thing. So my biggest advice would be, if you want to be extra prepared, you can try different electives and things, but just don't be afraid to try new things and grow out of your comfort zone and just learn at your first year out.
That's awesome. Like, so going along with that, you did go to a different DSO, and then you ended up at Aspen 6 months later. Do you feel like you've been able to learn even more with Aspen? Have you grown with Aspen? Did you feel a little different with the, different DSO coming out of dental school, even though there was a 6 month difference?
Every single practice you join is going to be a little bit different, not just in terms of like where it is or the patient populations or things, but even different practices. So the DSO I went to before was primarily a lot of, we did a lot of crowns and crown and bridge and things like that. And that's just how their offices were set up. And you didn't have to do it, but they really focus on those kind of treatment planning. So I got really good at that during that time. But I tell people, maybe in 6 months that I was there, I maybe extracted 10, 15 teeth the whole time I was there. And then Aspen Dental, I got here, and there's a lot more implants and dentures and Invisalign and things like that. And that's not all it is. Like I actually, since I have that crown and bridge background, I probably do more crowns than most of the other offices in the area, which is to my benefit. And you can kind of, you could treatment plan however you want. But I joke, like maybe in the first week here at Aspen, I was doing 10 or 15 extractions. And I remember when I started here, my first week in January, I was like, block off an hour for me for like a surgical extraction, because I had not probably done one since dental school. And I like was not comfortable using a drill at that point. But now I'll sit there and I'll do a full arch of extractions in less than an hour. And sometimes I'll do like a full mouth extraction, maybe an hour and a half or even less. So like I said, your knowledge and your skill level increases exponentially. Like the more patients you see, the more comfortable you get. And yeah.
Wow. So we do have like a doctor development program, a training program for new dentists, right when they graduate, as they come in and join Aspen. When, even though you were not necessarily a new grad, did you still feel supported? Did you still have an ability to have a mentor? How did that work out for you?
Oh yeah. And I think it's, again, it's different for every region, every office. They actually, here in Ohio, they have a couple more senior docs that have been doing it for 10, 15, 20 years. A few of them up in Cleveland, even a couple in the Columbus area that they'll have you like rotate through, and they'll kind of go over kind of just treatment planning, diagnosing, things like that. If you have specific, and it's nice because they'll tailor it to your individual needs. So if you feel like, hey, I'm not as good at treatment planning, or hey, I'm not as good at conversing with patients, they'll do that. I didn't have that kind of issues. Mine was more like, hey, let's go over like extractions or surgical techniques or things like that. And it kind of depends how long they even need to meet with you in that regard. So like for me, I actually wasn't even hired as an associate. I was hired as an MCD, which is a managing clinical director. So as a lead dentist. So I actually was only training up there for a few days before I actually came back and went to my office, because I didn't need much more, versus some people, they'll be up there for a few weeks, and it's completely your call and kind of seeing how comfortable you feel before you're ready for the next step. But I was definitely supported at whatever I needed.
That's awesome. And you did mention treatment plans. Are you doing your own treatment plans? Did they guide you on what you should do? Like how does treatment planning work with you?
It's completely your call. I actually, like I said, as a new dentist, I welcome the input of anyone I could. So whether it was my owner, Dr. Reddy, if he was in the office, sometimes I'd check, like I said, with my dad and ask him, hey, what would you do in this situation? Or I'd call another doc, like in the Aspen network in the area, and kind of ask them and bounce ideas off each other. But I tell my patients, you line up 100 dentists, you're going to get 100 different treatment plans. And it's kind of, there's some more conservative, some more aggressive. I'm probably more on the conservative side, but it's really kind of whatever you want and you're comfortable with, and whatever you think will help the patient the most. So it's completely your call.
So even being on the conservative side, it's still your treatment plan. There's no dictation of.
It's kind of funny. Being on the conservative side, I will be less aggressive, like filling things and doing things, and I'll space out my procedures more. But I actually think that benefits me and actually helps me produce more, because I have time to kind of go over treatment with patients in my new patient exam. I have time to sit there, and if someone wants to start something the same day, I can fit that in. And my office in Hilliard is actually the highest producing Aspen office like in Ohio right now, just because we've managed our schedule real well. We've done stuff like that. So people think like, oh, I need to do, oh, there's a incipient decay right here between these two things. You don't need to do stuff like that. If you treatment plan and know your schedule and kind of work it the way you want, you can really do really well, no matter how you treatment plan.
Good for you. That's awesome.
Yeah.
So I just had a student ask, should I go into residency? Did you feel like Aspen or even prior DSOs, did they give you enough support not to go into residency?
People ask me that question. It's kind of a very personal answer for each person. So my girlfriend, she's a dentist. She went to VCU Dental School, and she went to a residency at the Washington, D.C. VA. So she went the residency route. I went the private practice DSO, kind of just right into practice route. And if you asked us in retrospect, obviously COVID kind of affected things, but like she signed up for this residency and she had all these plans to learn. And she definitely learned things. She learned how to manage medically compromised patients. She placed some implants, things like that. But her residency actually during COVID shut down for 3 months, basically 4 months, and they didn't really do many procedures, versus in that time, maybe we were shut down, I think, for a total of like 4 or 5 weeks. But other than that, I was seeing patients and I was actually busier than I would have been. So I got a lot more experience, got a lot more speed. And on top of that, Aspen has a lot of like CE, where if you want to learn about, like I said, bone grafting, or if you want to learn about, like right now, actually, in the next few weeks, they're signing all the Ohio dentists up for an implant continuum. So they have like 60 hours of implant CE. It's technically supposed to at the end be an in-person kind of hands-on implant placing thing. Right now we can't do that obviously, but they're doing a virtual one via Zoom, and then after, when everything gets safe again, they're going to probably have it in person too. So really, if I tell people, if you can find a program that really hits what you want to learn, it can't hurt. But I almost tell people, if you find the right opportunity with like a DSO, for instance, like Aspen, it's almost like a paid residency, because even on my worst months with Aspen, I was basically making 3 times as much as my girlfriend did at her residency. And now if she was still in a residency, it'd be maybe closer to like 6 times as much. So it's definitely, you can learn things and kind of start to pay off those loans and start to progress with your life if you're working somewhere.
Yeah, definitely. So going along with CEs, can you choose what CEs you take? I know, Aspen's providing the whole implant course because that's a big initiative we're taking. But besides the implant ones, are you allowed to take any other ones that you have interest in?
Really, whatever you want. There's a link. I can't recall it off the top of my head, but it literally has all kinds of CE. And I want to even say, they told me at the last one of these panel things that I did, that the CE technically right now I think is open to anyone, even non-Aspen dentists, at least for the time being, just to help people out with COVID and things like that. So there's a whole bank. That's one of the nice things about a DSO like Aspen, because of how large they are and all the resources they have. Not only can you purchase supplies and things like that for cheaper than like a private practice would, but you can get access to the CE and all kinds of different things, and just at cheaper prices. And for us, it's free, a lot of stuff, but you can just really have a lot more opportunities than someone at a mom and pop, like my parents' private practice would be.
Yeah. So just to answer what the CE site was, it's aspendentalce.com. But yeah, and you're right, it is available until the end of the year. They might extend it, but it's all free CEs, and why not? And I think a lot of people say they don't even have to worry about their requirements of fulfilling all the CEs and everything.
I haven't even. I mean, especially with COVID, I've finished all my CE basically for the whole year just by kind of sitting working through stuff while I was furloughed for a few weeks.
Yeah, that's awesome. Let's see. So
you want me to answer that question from the chat?
I was just about to ask that. I'll read it to you. Okay. So I'm definitely interested in wanting to do implants. Is it better to go through residency to learn it, or do you feel like the CEs have been sufficient enough, or I guess Aspen Dental's program that we have?
If you want to like come out and right when you start practicing, know how to place implants and do things like that, then yeah, if you can find a residency that focuses on that, then that might be the route to go. But you also have to fit, and this is kind of what I've talked to my girlfriend about this exact point. She went to a program, she placed some implants, and she can technically place them now. She's not like, she didn't do so many where she can basically place any implant right now, obviously because of COVID too. But you got to figure she lost, at least in terms of production, by not working, anywhere from like $100,000 to $200,000. So would you rather do a residency and learn that, or would you rather work somewhere? And then even if you have to, if you don't feel like Aspen, if the Aspen implant CE isn't to your liking or isn't enough for you, you could pay $10,000, $20,000, go take a course while you're working, and you still come out ahead. So it's a personal thing, but in the end, if you're looking at it like mathematically or economically, it made more sense, at least to me, to do it this way. But like I said, I'm never going to tell someone that a residency is not the way to go. It's definitely I had a roommate that went out to one in Texas, and they focused on that the whole time, and that's really all they did, and he loved it. So again, it kind of depends what you do.
Right.
Yeah.
Yeah, and along with the the Aspen program, it's a new thing that we've just developed, and we're working out the kinks, of course, with COVID. But it's a bunch of CEs that you take virtually, and then from there, once you pass certain steps, it's provided, and you might have to pay a little bit to do this, but we go to a foreign country to help out and place implants, so you get all of that experience. But we're still developing that, and of course with COVID things have delayed, but just like Dr. Schooley said, he's going through it right now, and they'll figure out the next steps when it comes to actually.
I'll let you guys know in like a month and a half.
Yeah. We'll do an update one. Yeah,
we'll do a lot more about implants than I do right now.
Awesome. We'll do an update session in 2 months.
Yeah.
Wonderful. So if I work for Aspen directly after graduation, will they teach things like molar endo, surgical extraction, implants? I feel ready to go into practice, but I feel like what's taught in dental school is pretty basic and I want to learn more advanced techniques. This was asked by a student.
So are they asking, do they teach you those things?
At Aspen, do you feel like, because coming out of school, they feel kind of ready to go into practice, but they feel like it's very basic things. Does Aspen teach or help with perfecting molar endo surgical extractions?
In terms of like the teaching component would be if you wanted to sign up for some of these CEs. Like I even know, for instance, they have some endo CEs that maybe even focus on molar and things like that. I didn't sign up for any of those yet. I'll say when I graduated, I was all about like, I want to focus on molar endo. I want to do implants. I want to do all these things. Like when you hear in dental school, you're like, these are the high production kind of things. But then I was sitting there and I was in practice, and I think it was my first month or two with Aspen, and I was doing even some anterior endos, and they were fine. They went great, but I was like, the amount of time it took us to set up for the endo, do all that kind of stuff, I could just refer that out, and by the time it got back to me, I'd place a crown, and I could place a crown in like 5-10 minutes on someone, and I can just for my schedule, for me, it was more productive for me to use my time doing things like crowns or full mouth extractions and dentures and things like that. But if you're either good at endo or you want to get better and do molar endo, you can definitely have that opportunity with CE. And if you have molar cases that you want to do, no one's going to definitely tell you not to do. It depends on each doctor. So I know some doctors that do all of their own endo. I right now haven't been doing much at all because for me, it made more sense to refer it out and have them come back. So again, as far as getting training with that kind of stuff, it's mainly through like CE and things like that. If you want to pursue it.
Wonderful. And then going along with that, we do have endodontists and oral surgeons. Like Dr. Schooley was saying, he referred it out. We have endodontists and oral surgeons that come to our offices. So you can just put it on your schedule or their schedule, and the patient doesn't have to find another practice. They still get to stay within their network and everything. So it's really helpful.
And that's the nice thing too. I know someone was asking about like bonusing and pay and things like that. If depending on which office you're in, like all of them have oral surgeons that come in. Some of them have endodontists that are coming in, but at least all of them are ideally would have an endodontist and oral surgeon that come into the office. If your oral surgeon or endodontist does a procedure in your office and you're the MCD or lead dentist there, you bonus based off of what they do. Obviously you don't get as much because they're doing it, but it's basically you're getting money for someone else to do the work. So that's another thing, like I was saying, like it just does more for your time to do things that you're really good at and to let more of the specialized things. Like for me, I don't want to sit there and chase like an MB2 and a molar and sit there and do these fine little details and take it like 15-20 minutes to do something like that. So again, it's nice where I think the next couple of days our oral surgeon's coming to our office and he's doing all these sedation, wisdom teeth cases. He's doing some implants and stuff like that. And on top of that, when I have downtime, I can kind of shadow him, and he loves showing me tips and tricks and things like that. So kind of to your point earlier, if someone wants to learn things, you can learn a lot from your specialists that come into the office too.
That's awesome. Yeah. I mean, MB2s are the worst.
Everybody's like, what?
I'm like, oh my God, those MB2s. But going along with that, so you're not fighting for procedures. Like the office is more of like an entity. It's not like you are fighting with the associate because you want to have the crown and the crown seat and all that kind of stuff. It's an overall, family basically, and relationship when it comes to the profiting and the collections and production of the office.
Exactly.
So you don't have to worry about if you have the oral surgeon or the endodontist. If anything, it really benefits you in the end with our profit sharing model and the bonus.
And if you're an associate somewhere, obviously your managing clinical director will kind of have a say of like, let's say there's some patients that he prefers to see because he has a relationship with them or whatever. That might be the case where he'll want to see those people, but they're never going to be like, oh, I'm taking all the crowns or all these things, because it's in their benefit to have you get better.
Right.
That's why sometimes even now, even though I'm only a second year dentist coming out, we have a couple of the new 20 grads that are kind of rotating through my office right now. And at first I'll start them off on some slower stuff, see how their speed is. And now I'm picking it up because it A, helps them, and B, helps me to kind of pass off some of these things to free me up as well. So it's in both of your interests to practice and get better at everything.
Right. Thank you for that. That helps a lot. Kind of dental question. What does a new dentist find frustrating?
What do I find?
Or what do you find frustrating? Nothing, exactly.
I should have an answer for that. Let me think about that.
Okay, we can totally come back. What are you enjoying about dentistry?
I just enjoy, like, obviously when you get out, you're excited to try new things, but it's so rewarding after, like I said, now I've been out for a little over a year, and just seeing how much I've progressed in the last year. Like, before, I would have gone, if someone put a full mouth extraction on my schedule, I would have been like, what are you doing to me? Like, I would have dreaded it the whole, like, night before, 2 nights before, whatever. Now I'm like, okay, I got this. Like, and the nice thing is also, like we talked about with surgeons and people rotating in, let's say you get into something, you obviously don't want to do anything that's going to harm the patient or whatever. So if you say, hey, this is a little out of my comfort zone, some root tip you don't want to go chase because it's near a sinus, you just say, hey, close this up, and my oral surgeon is going to come in later this week or next week and kind of fix this up here and finish off the case. So it allows you to try things, maybe get a little out of your comfort zone, but again, you have that safety net where you can kind of pass something off if it's something that you don't really feel comfortable with. So I think the thing I like is I'm getting a lot of confidence, getting a lot of experience, and like it's just a great kind of feeling to feel like, hey, I've kind of finally made it after all that 9 years of working towards it.
Of course, of course. Just had someone ask, what is one thing you really like about Aspen and one thing you would like to improve within Aspen?
The thing I like how you have, because like I said, you have such a large kind of organization behind you. You have access to all kinds of CE that you normally wouldn't have. You have access to purchase. Like I was looking on our formulary the other day because we were ordering some, like either I think it was some elevators or some kind of different types of cement. And it would have cost like 2 or 3 times more if I was purchasing that as a private practice. So you can get these things for cheaper. And also on top of that, you can practice with different types of things. So like I was like, hey, I want to try this other type of material. If you're a private practice doc, you're like, hey, I don't really want to waste my money trying different things. But right now you're like, okay, I have some flexibility where I want to see if this works better or not. And I've actually found different tools, again, that have made me quicker, better, that I probably wouldn't have even tried if I didn't have that kind of opportunity. Plus just the support behind you, whether it's mentors, whether it's owners, whether it's support people. And on top of it, like you said, once we're back up and running, they have a lot of fun events in different cities, and you meet a lot of docs. I think to answer what I maybe don't like, or maybe something that's, I think someone asked basically a similar question before we were going to come back to. Sometimes, because I think it's the case with any DSO, especially depends where you're at. I'm probably at one of the busier offices definitely in Columbus, probably in Ohio for Aspen. We see, on average, I want to say it's like 22, 23 existing patients and about 6 or 7 new patients a day. Now, before anyone says that's 30 patients, that's so many, how do you even do that? Most of those existing patient appointments are about 5 minutes or less, where someone comes in, you try in a wax rim, you do something, and sometimes I don't even have to pop in the room, or they'll just hand me a denture, I need to adjust it or something like that. So, but one of the things that's tough, sorry, I'm on a Zoom call. I think someone's knocking on. One of the things that's tough sometimes is when you do have different patients and you need to see, it hasn't been a case too often, but sometimes I'd like to have a little bit more time to sit with maybe a new patient and go over things. And I personally, I will do that, and I will take that time, but then I'll have to like catch up a little later. So maybe I'll have to run into my lunch a little bit, or it'll go a little later in the day. But honestly, that was more of an issue when I was first starting, because I wasn't as familiar with how long I needed for a procedure. But now that I know, like, this is how long I need, I'll actually block more time than I need. So I actually never run over anymore. Like I actually make it a point with my staff that we never stay late. Like I think the last time we stayed after we were supposed to was probably like 2 or 3 weeks ago. And that was only like 15, 20 minutes. So that's another thing. You figure out what you can do, how much time you usually need, and you can kind of budget your schedule accordingly. So again, it was maybe a negative, or not even a negative, just something that was a little inconvenient for a time. But once you figure it out, it makes things so much smoother.
Yeah, that's awesome. So like, there's no managers like saying you should
You
not
you
take
have,
this much time.
so this might be another question. How's like an Aspen office structured? You'll have an office manager in each office. You have what's called a PSR. It's basically like your front desk staff that either runs insurance, answers the phones, kind of greets people when they come in. You have some assistants. So we have 3 assistants. You have a hygienist. We have 1. Some offices have more, and then a doc. So as far as your schedule goes, I'm really close with my office manager. So I'll say, hey, Chris, this patient needs this treatment. And usually because we worked with each other now for a few months, he knows what I need. But every once in a while, like if it's something where I'm like, hey, I might need a little more, a little less, I'll say like, book this for 2 hours with me, or book this for 30 minutes with me. And then they'll put it in the schedule. Another thing, and this kind of goes back to what has made my life easier, and what maybe was more difficult at the beginning. At the beginning, I wasn't looking at my schedule ahead of time. So I would kind of go like maybe the day before and look at something. And sometimes something would be scheduled a little off and we'd kind of run behind or have issues. Now I'm always looking at my schedule 1 week in advance. Like I go, like today was Monday. I looked at next Monday, Friday, Thursday, Wednesday, Tuesday. I looked at all the days in between. And if I see anything that's even slightly off, I'll just leave a little Post-it note on my office manager's desk saying, hey, move this or do this or kind of do that. And that just sets us up ahead of time to not have issues. So,
Right.
yeah. But whatever you need, they'll make it happen for you. Sometimes, I mean, it hasn't happened for me. Sometimes if you're like, hey, give me 3 hours for a filling, they're going to be like, really? Do you need that? Like, but no one's going to do that because the office isn't helping people and you're not really making anything if you do that.
No, of course. So speaking of like length of time, what hours does a new dentist or an MCD work a week? Do you work longer than associates?
I think it's basically pretty much the same hours for everybody. I'm sure based on personal kind of situations, if you need different, like we have an assistant right now, she's actually pregnant, and we have to kind of close or kind of open at different times based on when she has some of her appointments and things like that. But for the most part, I think it's usually around 40 hours a week. You have usually maybe around 1 Saturday a month, but Saturdays are definitely shorter days. I think it's way less. And depending on how many docs are in an office, you can even kind of alternate those or things like that. So, but usually it's about 40 hours a week, Monday through Friday, and you can kind of space that up however you want. Most offices like to have at least 1 late day that goes until 7. And then some offices, they'll start early. And then like me, for instance, I don't love waking up early. So every day at our office starts at 9. So
nice.
usually I'll end around 6, but Fridays I end early and we end around like 2 or 3. So it's kind of whatever works for you. If you can kind of make it where you have enough hours to see patients, they'll work with you to kind of make it happen.
That's awesome. And you were able to say like, actually, I need 9 to 6. I need to sleep.
Not even that. It's just, I didn't demand that for every day, but like we made it work with the schedule where we were able to see enough people and kind of do that.
So I just had someone ask, this is along with mentorship, but they asked, I'm a bit nervous about hand speed coming out of dental school next year. Do you feel Aspen has a solid mentoring program?
Hand speed.
Yeah, I don't know if like speed.
Well, maybe just speed of like procedures or things like that. Maybe, I mean, actually, because I was talking to a recent 2020 grad about this the other day, because she, because of COVID and things like that, didn't have like the last few months of dental school and things. But again, with the mentorship, if you're first out and you get hired and you're going to, whether it's the actual Aspen training that you get sent to, or if you get sent to a doctor's office to learn things, if you say, hey, I need some tips and tricks to maybe improve my speed with fillings or things like that, they'll definitely go over that with you.
Right.
The other thing I tell people is you're used to dental school dentistry where you have to sit there and do like a class 1 prep or class 2 prep in the pits, and you're sitting there trying to make it every fraction of a millimeter you're paying attention to. And with your crown preps, you have to sit there and do every single buccal cusp and lingual cusp and just shape. Like Real dentistry isn't like that. You literally just see where the decay is on the x-ray. You go in there. Most of the time, if the decay is there, the handpiece just drops. You clean it out pretty quickly. You make sure there's nothing sticking. And it's way, way quicker because you're not worried about having these exact dimensions, because no tooth actually has those exact dimensions. So that's the other thing that's nice. You're used to kind of dental school where you have to do things a certain way versus dentistry. You want to take care of the patient and get rid of their pain and get rid of their actual root of the cause, which is the caries or decay. So as long as you do that, you're
Yeah.
golden.
I would also recommend, all these fears, while you're in dental school, I'd recommend shadowing. Shadow some of these dentists before, choosing what your career path is going to be it private practice, DSO. You can come into one of our offices and perhaps shadow Dr. Schooley himself and see, how his regular day is, and, ask him questions as he's with patients, and, just pick everyone's brain to really figure out, what you want to do, and if this seems too fast, or if residency is a better option. Just explore everything that you can, so you don't have those fears graduating out of dental school.
And I tell people, like, I'm never going to be one, at least my personal philosophy, be like, hey, you need to do this, whether it's you need to go to a residency or you need to do DSO or you need to do private practice. Because like I said, there's different DSOs, there's different practices that might be a better opportunity for you. It's kind of your own personality and kind of what you mesh with and who you're working for, like I said. So, and I think that resonates even with people when they're hiring. Like, you don't want to be kind of, you don't want it to be like a used car salesman where like, hey, this is this and this and this, because then it kind of sounds fishy. Like, I tell people, this is how it is. And if you like it, great, kind of come and see what it's like. And if you don't, I mean, you're going to find something that works for you. Like, dentistry is a great field and there's plenty of opportunities.
Right. So going along with that, with like DSOs, the different options, how do you feel about the stigma associated with DSOs? What would you say about that, since you have also worked for 2 DSOs?
I was actually just talking about this the other day because one of my old med school roommates, I was getting pho with him, and he's like, I was telling him I was working for Aspen. He's like, oh, like, isn't that a DSO? Like, how do you feel about that? And I was like, honestly, DSOs in general get a bad rep, but it's kind of, you got to think about when you look at reviews online. First off, anyone that's been in statistics knows people are more likely to write a review when they've had a negative experience. So you don't see all the hundreds of thousands of people that had good things because they had a great thing. They don't need to go and complain about it. 2, I'll use dentures as an example. It's a perfect one. Someone comes in with no teeth or very few teeth. They get their teeth extracted on the mandibular arch. You have bone loss down there. No matter what I do as a dentist, a denture is not going to fit on an arch with no bone. Like, we can sit there and do relines and adjustments and whatever we can, but unless you get implants down there, something's not going to fit. And we can tell you that till we're blue in the face ahead of time, but some people either they don't listen or they're maybe older and don't remember things like that. And then they'll be like, this denture doesn't fit. We're like, we told you this ahead of time. So it's just, you gotta understand a lot of times with reviews and things like that, you gotta think of who are the people that are saying it. And also, there are, like, it depends who your dentist is. Like, if you're in a DSO and you're in a practice where you have a good dentist, you're going to have a great experience. Not all dentists are the greatest thing in the world. I'm never going to comment whether on someone's work, whether they're good or not, because I'm new. I'm not a perfect dentist myself either. I make mistakes, I'm sure. But as long as you feel like you are taking care of your patients, and your patients like you and you're doing good work, I think a DSO is a great opportunity, because it's like, think of this, whether you yourself as a dental student and you're applying to whether it's a DSO or a private practice, you're the same dentist either way. You're treatment planning the same way either way. So it's like, do you think you're a good dentist or do you think you're not? Like,
Yeah.
it's not the DSO, it's the dentist.
Yeah. Yep. And the reviews shouldn't affect you, because you're going to know there are some people that just won't like you or not understand.
Like a perfect example, I saw one for our office the other day, and it was like, I went to the dentist and they told me I needed a scaling and root planing and a deep cleaning, and it was this much money. And I went to another dentist and it was only like $50. Well, they don't realize most dentists that are old school mentality, they didn't even do scaling and root planings at that time. And if you do a prophy, yeah, it's going to be less, but they're going to have that decay near the bone levels, and their bone levels are going to drop, and the teeth are going to become loose, and their teeth are going to fall out. But a lot of people either don't know about it or don't care to explain all that. So yeah, you can get in a situation like that, but are you really doing the best thing for your patient by not prescribing that? So
Right.
yeah.
Very true. Now, going along with office staff and all of that, you being a lead dentist, are you involved with hiring office staff, associates, hygienists, front desk?
We haven't hired like any associates here in my office yet, but as far as we had one assistant, I think she moved, so we were hiring a new one, and they brought a few candidates in, and they met with me, they met with the staff, and we kind of chimed in our input and picked the one. So definitely, I do have input on who eventually gets hired in the office, and we also hired a second, just actually the other day, we hired a second PSR front desk staff person. So same thing. I met her. I kind of more so answered her questions, but kind of just felt her out. Kind of saw like if she would fit in with the team well, if she was a hard worker, and kind of you definitely have a say in whether someone gets hired or not.
No, that's awesome. Makes sense because you're with them all the time.
Yeah.
So.
And that's the thing. It's not only in a dental office in particular. It's not as much as can they do the job. It's are they going to fit with the team? Like if you have someone that's going to be just negative all the time, or not someone that can take a joke or kind of laugh with everyone, then maybe it's not the right person for your office. At least mine, we're very laid back and we like to joke around and things like that. So we need someone that's going to fit that vibe as well.
Awesome. Yeah, no, that totally makes sense. Do you know, like from your experience, what do Aspen dentists or Aspen owners look for when they're hiring an associate or when they're hiring a lead dentist? You know, if a student was coming out of dental school, what would you recommend for them to be the best candidate?
I can't speak for all owners or all lead dentists, but myself, when I'm interviewing someone, I actually at Ohio State, I was president of the school, so I was on, and as part of that, we helped out with the interview days for like undergrad students applying to dental school. And people are like, do you look for DAT scores, or do you look for grades or service and things like that? Like all those things may play a little bit into your resume, but myself and a lot of the people that are interviewers, we just look at, can you have a conversation at it with us? And do you seem like someone that's going to fit into our program here? And I treat applying or interviewing someone for a position the same way. I can kind of, you can sit there and say, oh, I did this many failings or this and that, like, but everyone that graduates dental school has a dental degree. So that means you've met the minimum requirements, whether it's board exams or competencies or things like that. We want to see, can you communicate with me? Because if you can communicate with me, you can communicate with a patient. You can have the greatest treatment plan in the world, but if a patient doesn't understand you or doesn't trust you, they're not going to do it. And they're going to go next door to another office and get work done. So I think the biggest thing is having someone that can communicate. And another thing is just having someone that's like a positive person and a hard worker and want to be open to learning new things.
Definitely. Great advice. With Aspen, we did talk about mentorship. You know, you have people you contact your dad sometimes. Do you still have a mentor at Aspen? You know, being here for almost a year now, are you still in contact with them? Are they easy to access?
So I'd say right now my biggest mentor, I always have my dad that I ask questions to. At the beginning, Dr. Popa, he was the one I met with in Cleveland. Great guy. I asked him questions at first. Then Dr. Q, he's another doctor in the area in Columbus. I asked him some stuff. But now, if I have any real big questions, I'll ask Dr. Reddy. He's our owner. He owns probably, I want to say, between 20 and 25 offices in Ohio. And he kind of gets back to me pretty quickly. Like, perfect example is this Thursday, I have a few cases with implant overdentures where one of maybe the housings isn't fitting exactly how I want it to. And I'm not as comfortable or familiar with chairside pickups of dentures. So he's coming down on Thursday he lives in Cleveland. He's coming down and he's actually spending the whole afternoon with me doing some implant overdenture chairside pickups with me. So like, that's a perfect example. Like I was not out of my comfort zone. I tried some things with overdentures. A lot of them had been working. A couple of them aren't working to my satisfaction level. So he's going to come down and help me kind of learn so I can do more of them in the future and do them well for the patient. So
yeah, that's awesome. Can you speak on the technology and like upgrades, updates in the Aspen dental offices? What do you guys have technology wise? Are you guys paperless? What is it?
Everything's paperless. I mean, consent forms and things like that, we'll have the patient fill out and then we'll scan it into their chart and things like that. But we have intraoral scanners in every office. You use those not only just to scan for like crowns and Invisalign and things like that, but honestly, also we do basically an oral health scan at the beginning of most appointments, just so patients can see what their teeth look like in a 3D view, because it's easy for me to point at an x-ray and say, hey, this little black area is decay. First off, they're like, what's decay? I'm like, oh, it's a cavity. But then you show them on the 3D image and like, oh, what's that big hole there? And I'm like, that's your tooth. And then they're much more likely to get something filled or crowned or something like that when they see the hole versus looking at a 2D image on a screen. So that's a nice thing. Coming up, because Aspen's making a move towards more implants and things like that, I believe, I'm not sure what the timeline is, but in the next year or two, they're trying to put CBCT machines in virtually all offices, or a lot of them. So that's on the horizon. It's basically anything that's really cutting edge or state of the art, they're trying to put in the offices now. So I don't think there's any. In my other office in Virginia, I had a milling machine for crowns. We don't have those, at least in my office. But honestly, I've actually felt that that's actually helped my production and saved me time, because at my other office, I was spending like an hour or so waiting for the crown to be milled. The patient would have to wait in the chair. They'd sit there, and then you just have to do it all in the same day. Versus now, before I even prep the crown, my assistant has already made a model for a temporary. I prep my crown, we put a temporary on them, they go home. 2 weeks later, or even sometimes less, closer to 1, because we scan all crowns, they come back and they get it on. It's a very carefree kind of procedure. So yeah.
It's not like sending it like in the package like back in the day, since you
No,
guys
we actually, I was doing that my first month or so. We were sending them, but we found sometimes the impressions don't come out exactly like you like, and B, because you have to send a model and the lab has to get it, pour it up, do all that, send it back. It added like 3 or 4 days to do it that way. So now we just scan it, send it, and they already have it instantly. So we did like a six unit bridge the other day. We got it back from the lab in less than a week.
That's awesome. And we also have internal labs too for dentures. Can you speak on that?
Oh yeah, I didn't even mention that. So so when I'm talking about labs, that's more for like crowns and things like that. As far as dentures, every single office, or I assume it's every office, has an in-house lab where you have a lab technician that does all the different steps, whether it's wax bites, wax tries, kind of putting things together for you there. So that's the nice thing. I think that's actually one of the biggest benefits of an Aspen office, because especially for dentures, where someone comes to another office, like a private practice, like, I want dentures. Well, you have to have an appointment with where you extract the teeth, but then you have to sit there and do a wax bite, and you send it out, and then you have to, and if you're not sending out, you have to place all those teeth. And for anyone in dental school that remembers making a denture, no one wants to set teeth. It would take me probably hours to do what my lab technician can do in probably 15 minutes. Like, they're wizards. I don't know how they do it, but that's one of the big benefits, is having an in-house lab.
Yeah, students are always like, I hate doing dentures. And I'm like, it's not the same like coming out of dental school, because in dental school, you guys had to do everything? Like,
oh yeah, we had to do everything, and I didn't even know what was going on.
Like, you had to physically like make.
And that's actually, I mean, I can say this in retrospect. When I started with Aspen, I remember the stuff from dental school, but I actually just had my clinic binder that I would look at before every single appointment. I'm like, this is the wax rim, and this is the wax bite, and this is what you need to do. And I was like, oh man, I'm going to Aspen. We do a lot of dentures. I don't know this stuff. Within the first week, whether it's from my assistants or from my lab tech, I picked up everything very quickly. And now it's like second nature to me. Like, this step, this step, this step, this is what you need to do. And it's great.
Yeah. So it's not as traumatizing as dental school.
Oh, no, not at all.
Good.
And honestly, and that's also the nice thing. Let's say something goes wrong and something doesn't fit. You have an in-house lab, you just redo it, and it's really quick.
Yeah. And the lab tech can come up front too, and like sometimes check if you
sometimes if I'm like, oh, this looks a little funny, I'm not sure if there's a way that we can fix this way, I'll call her into the operatory, and she'll take a look, and she'll be like, oh, that's an easy fix. Take it back. 5 minutes later, this fits perfect, and they love it. They fine, and you're like the happiest person in the world, because you made someone like their life just because their teeth look amazing.
Yeah, instead of having to send it out, wait a couple weeks, all that stuff.
Yeah.
Awesome. So speaking of like, making a patient's life different, I had a question regarding charity and giving back. Is that something that Aspen provides? Do they provide opportunities for giving back?
I know they have mission trips and things like that. I haven't been with them long enough, and especially with COVID, I don't think there's any of those going on right now. I know there's also a day of service where they do, which group?
It's the veteran with the veterans.
The veterans, and there's actually, yeah, it's with the veterans, and there's a like a one of those mobile.
Yeah, the mouthmobile. Yeah.
I haven't been on that either, but they actually do that as well. And on a personal level, like I wouldn't do this all the time, but if there's a situation where you feel like someone really needs something, and you can work with your manager and do some type of discount or things like that to really make something work for someone. And that's the nice thing with Aspen Dental. Not only can you apply discounts to things, but also there's financing and things where they can break up payments and really make any kind of treatment affordable for most people.
So you do have say like, if the price you think is just a little too much for this particular patient or something, if you want to give back, you can do. That's so nice. That's awesome. I've been part of the Mouthmobile, and it's such a great experience. They have this bus that has like 4, 5, 6 ops in it, and it goes from one side of the nation to the other, and we stop near locations where we have offices, so our dentists can come in, help out, and it's all for veterans. It's all free service for them, and we have like you said, the lab wizards. They're sitting like outside of it, just like fixing partials, fixing dentures, like right there, and able to deliver them immediately, which is amazing. But it is a good experience. So Aspen does give back, and then of course, like Dr. Schooley said, the mission trips too. But with COVID. But speaking of COVID, you did talk about, you were closed for 5 weeks. Did you do any teledentistry? How did that work for you? You were just shut down, and then they brought you back?
So, it was the last week of March. I was furloughed, which means I wasn't working. I wasn't getting paid, but I was able to collect unemployment if I applied for it or something like that. But basically, after we opened back up, we started off slower. And even still, we gradually like picked it up to a level that we were comfortable with. And I don't know if this is a question, but my mom, because actually when I moved back from Virginia, I was going to get a place. I ended up being at my parents' place just because of COVID and all that stuff. And my mom was one of the ones on the side where she was very paranoid about COVID. So as soon as I got in the house, it was like, take off your clothes, wash, like shower, all that kind of stuff. So like I was definitely on like hey, we need to make sure we're doing everything to be careful, but I never had to worry about that because within the office, as soon as someone comes in, first off, they limit the number of people that are in the waiting rooms. They'd come back, they'd answer before they come back, they answer all kinds of questions. Have you been around anyone with COVID? Have you been to any other areas? All that kind of stuff. Once they pass that screen, they come back, get their temperature checked. We have hydrogen peroxide mouth rinse. We have basically N95s. Like I have so many boxes of N95s, I don't know what to do with them. Level 3 masks for everyone. So I've always felt really safe. But as far as teledentistry, that was an option. I know a bunch of dentists did that. I personally didn't, also because actually the computer I'm on right now is my sister's computer because mine crapped out, and so I'm on that. But yeah, I didn't do the teledentistry, but yeah. But I know that was an option as well.
Okay, cool. So you were just furloughed for 5 weeks, receiving full health benefits as well as the option to do unemployment. And then after 5 weeks, you came back, and it's kind of been busier than ever.
That's the thing, is actually because a lot of other office, not just private practice, but even some DSOs in the area had to like close down or were bankrupt because of the situation. We've even had like an uptake in the number of patients that wanted to get in with us. So it's, I guess, going back to what's a downside right now, we just haven't been able to get everyone in. Like I think right now at my office, the wait time to get into my office for a new patient is 9 or 10 days.
Wow.
Now, obviously they have high need column for if someone calls in the day of and they have something going on, we can get them in pretty quickly. But a lot of people that are coming in for checkups, like they're like, oh, I signed up a couple weeks ago. And I was like, sorry, like we can only see so many people in these times.
Well, thankfully our network is so big that, they could go to another office.
And that's actually what's happened a few times. So one of the other offices, I think it's probably 15, 20 minutes away, has a little slower schedule. So sometimes patients will go there and they'll either stay there or they'll come back to us when there's an opening. So that's the nice thing, because of the flexibility in offices. You can go different places. So that even works with like the oral surgery schedule. Like let's say someone is like going out of town and there's no time in your column to get a procedure done. You can say, hey, you want to go over to Pickerington or you want to go over to Delaware and get this done? And you just call the office. They say, hey, that works for us. And it really helps the patients that you have that flexibility as well.
Yeah. And with electronic charts, it's all.
They don't have to do anything. It's every single note I write and every single x-ray is on there.
Oh, that's awesome. Even like the iTero scans, all that, everything's there. Oh, that's awesome.
ITero scans, they would have to transfer over, like, I think they're stored under a doctor's, like, I want to say it's under one of our Invisalign accounts, but you would just send that over and it's really easy.
Just super easy though. Awesome. So this is non-dental, just kind of to wrap it up, but non-dental COVID related. If COVID didn't happen, what would your summer look like, or what will be the first thing you do when you have full freedom?
Oh, I want to travel. I joke, like, I haven't I haven't really gone anywhere or done anything for months. I've kind of written this off as like a lost year. Like I'll do little things here and there with friends, but like I'm ready. I'm a big traveler and I want to go and not just United States, but maybe go to Europe for a few weeks or something like that. So yeah, I think that would be the first thing I do is kind of plan a trip to go somewhere. Because right now, I mean, everyone's getting a little stir crazy, just kind of being in their houses and things like that. At least we have Buckeye football back. I was really bummed when Big Ten was shut down, so at least I have that to look forward to now.
Sorry, my boyfriend just went boo. Oh, God. Did you hear that?
I can't even complain. The Wolverines helped us get Big Ten back, so I'm all for it right now.
He's an MSU fan too, so
Anybody but Clemson.
that's awesome. Well, thank you, Dr. Schooley, for coming on and doing this Ask Me Anything session. I don't know if there was anything else you'd like to say before we close out. Any closing remarks?
Nothing. Honestly, just if anyone has any other questions, I know Ruby gave her contact information, and you can just look me up on any social media. I'm always willing to answer any questions, or if you're gonna want to come and watch things or anything, just let me know.
Wonderful.
Even if it's questions about dental school, like I was just there a couple years ago, and I can answer anything there too.
Yeah, wonderful. Thank you for that. So like Dr. Schooley said, you guys should have my contact info. I did put it in the chat, so feel free to take it from there if you, for some reason, don't have it. Email me, text me any questions you may have, and if it is something you wanted to direct towards Dr. Schooley, just indicate so, and I can forward it over to him and get you guys connected for, questions, shadowing, all of that good stuff. But other than that, I just wanted to thank you, Dr. Schooley, for helping me host this. And thank you to all those that attended. And thanks for those amazing questions. And we'll be tuned in again next week with a different doctor. So have a good evening.
Thanks, Ruby. Thanks, everyone.
Thank you. Thank you. Have a good evening.
You too.